Drug dependency is a crisis that continues to impact lives, communities, and the future of our nation. It fuels crime, breaks families, and hinders the growth of individuals and society, like Region 2 has not been spared. But amidst the darkness, a beacon of hope emerges, fueled by compassion, collaboration, and the power to transform lives. With the signing of Republic Act 9165, or the Comprehensive Dangerous Drugs Act of 2002, the nation committed to fighting drug abuse through prevention, treatment, and rehabilitation. Region 2 was chosen as one of 10 priority areas needing a government-run rehabilitation facility. Despite early interest from several provinces, the perfect location remained elusive. Then, disaster struck, Typhoon Ondoy in 2010. Funds earmarked for Region 2's treatment and rehabilitation center were diverted to rebuild flood-damaged health infrastructure, delaying the center's birth. Years later, through persistence and partnership, the city of Ilagan and a generous donor stepped forward. In 2012, the Department of Health received 1.97 hectares of land in Barangay Centro San Antonio through Mayor Jose Marie Diaz. A memorandum of agreement was signed to bring the vision to life. Initial funding of 50 million pesos came from the Department of Health and Dangerous Drugs Board. Construction began, and even as buildings were incomplete, advocacy and training programs launched across communities. Under Dr. Charity Canapi's leadership starting in November 2016, the center rapidly progressed. With her team, she completed policy documents, forged interagency ties, and led benchmarking visits to establish TRCs. Licensing standards were met, infrastructure was finalized, and personnel were trained. By March 2017, the center was accredited for a 50-bed capacity. In April, it welcomed its first residential clients. 2 months later, it was officially inaugurated. The Inpatient Rehabilitation Program of the DOH-TRC Region 2 uses the Modified Therapeutic Community or TC as the modality of treatment. It provides environment wherein people get help by helping others. The operation of the community is the patient's task, under the supervision of the rehabilitation team. TC operates with a hierarchical structure, similar to a family, where each member has a defined role and responsibilities to sustain the proper functioning of the community. The inpatient program provides a path for recovery and improve the physical, spiritual, psychosocial, and emotional well-being of drug dependents and their families through an integrated system of addiction medicine, psychosocial interventions, vocational, and spiritual services based on a balanced program of patient care, education, and performance measurement. The program is basically divided into 3 phases of checkpoints and milestones. The Emotional and Motivational Unit or EMU phase, Junior phase, and Senior phase. This also applies for the adolescent program. Patients start their early phase under the Emotional and Motivational Unit, wherein patients are subjected to the initial medical and rehabilitative services such as program orientation, motivational interviews, self-awareness sessions, psychological assessment, and other activities to develop patients' motivation and readiness to accept help prior to formally starting with their program. As one of the center's ways forward, patients recommended for release will be enrolled in the Prepare or the Preparation for Reintegration and Evaluation of Patients Prior to Aftercare program, the Real-World Experiential Learning program, which uses real-world work simulations to help them transition back into society. This program addresses challenges like stigma, skill gaps, and emotional stress by assigning tasks based on each patient's background, building confidence, and reducing the risk of relapse. Through the case management team, composed of physicians, nurses, psychologists, social workers, and case managers work collaboratively to address the medical, psychological, and social needs of each client. Clearly defined phases such as assessment, case reviews, transitions, and aftercare planning, the program ensures that every client is supported throughout their recovery journey and prepared for reintegration into the community. Recovery is a lifelong process. To ensure that patients remain supported beyond the facility, DOH Treatment and Rehabilitation Center Region 2 implements the Aftercare Program, a structured continuation of care designed to prevent relapse and guide reintegration. Spanning 18 months, the program is divided into 3 key phases. Intensive phase, bi-monthly sessions focus on coping and relapse prevention. Continuing phase emphasizes employment readiness, community re-engagement. Maintenance phase focuses on long-term goal setting and self-sustained recovery. Holistic services are provided, ranging from cognitive behavioral therapy, livelihood training, health education, to psychological counseling, spiritual enhancement activities such as counseling and recollection, and family enhancement sessions. Only after meeting all 7 recovery indicators, including clean drug tests, social responsibility, and community reintegration, can a patient complete the program as prescribed by RA 9165 and DDB Regulation No. 1S, 2000. The outpatient program is tailored for individuals with moderate substance use disorder, allowing them to maintain daily responsibilities while undergoing structured rehabilitation. Spanning 6 months to 1 year, this program integrates Entrepose, an evidence-based model introduced by the Japan International Cooperation Agency or JICA. Entrepose includes 6 core components. Program orientation, CBT sessions, CBT evaluation, psychoeducation for patients and families, self-help group meetings and individual counseling and assignments. Patients are grouped consistently to foster trust and peer accountability. The involvement of families further strengthens the recovery journey. The case management team works collaboratively to address the medical, psychological, and social needs of each client to ensure that every client is supported throughout their recovery journey and prepared for reintegration into the community. Through comprehensive inpatient care, structured aftercare, and flexible outpatient programs, Department and Health Treatment and Rehabilitation Center Region 2 remains committed to healing lives, one individual, one family, one community at a time.